Hi, I'm Beth. I'm a speech and language pathologist, and I wanted to come on again to reiterate the importance of addressing sensory dysregulation prior to or during a speech and language treatment session. In my professional opinion, it is crucial that your speech and language pathologist that is working with your child address these. If you are working with an occupational therapist, the speech and language pathologist should be communicating with the OT. If they're in the same clinic, that's great. If you need to sign a waiver, that's great. If your child is not working with an occupational therapist, speech pathologist, we still need to do the best that we can do to address sensory needs. If a child's sensory system is dysregulated, they will not be able to attend and learn what we are attempting to teach them. It is possible to do this. For example, in the last week, I have gone outside with a client on a trampoline. We did therapy outside in the yard. While on the trampoline, the child was able to jump and get the feedback that he needed, and then sat right down on the trampoline and was able to work with me. We verbalized, we did puzzles, we did verbalized shapes, we sang songs. And then when he needed to bounce again, he got up, bounced, got the sensory feedback that he needed, and sat right back down and did more. If I was to make a child who is dysregulated, for example, sit at a table because I had an agenda, I might be meaning well, but I'm doing the child a disservice, or I'm not attending to sensory needs if I make them try to sit down at a table and their sensory system is dysregulated. We need to think outside the box as speech pathologists and work with OTs. If we can't work with OTs, we still need to think really outside the box as parents if they know what helps regulate their child's sensory system. If your child has significant sensory needs and they are working with a speech and language pathologist that does not incorporate their items from their sensory diet or does not attend basically to their sensory system dysregulation and engage a child in movement or any type of sensory activity that helps them regulate, or they're for some strange reason not willing to talk to your OT or even you about what helps the child regulate and then incorporate it either prior to or during sessions, I would look for a different speech pathologist. It's possible that they just don't have the experience and they don't know. So maybe even just educating them and asking them, hey, can you talk to the OT? Maybe they don't know. So maybe just give them that option to talk to the OT and learn how to incorporate it. We all have different strengths and you need to do what's good for your child.